Welcome to another informative session. Today we're delving into the world of mental health, more specifically panic disorder. Panic disorder is a type of anxiety disorder characterized by unexpected and repeated episodes of intense fear accompanied by physical symptoms. These symptoms can range from heart palpitations, sweating, shaking, sensations of shortness of breath, to feelings of impending doom. Now imagine being hit by a wave of these symptoms without any warning. That's the reality for those living with panic disorder. It's not just about being a little stressed out. It's an overwhelming fear that can strike even during sleep, leaving a person feeling out of control. Before we dive into the symptoms, it's important to understand how panic disorder is diagnosed. The Diagnostic and Statistical Manual of Mental Disorders 5th edition, or DSM-5, provides the following criteria for diagnosing a panic disorder. 1. Recurrent unexpected panic attacks. A panic attack is an abrupt surge of intense fear or discomfort that reaches a peak within minutes. 1. At least one of the attacks has been followed by 1 month or more of one or both of the following: persistent concern or worry about additional panic attacks or their consequences, significant maladaptive change in behavior related to the attacks. 1. The disturbance is not attributable to the physiological effects of a substance or another medical condition. 1. The disturbance is not better explained by another mental disorder. These criteria are used by mental health professionals to diagnose panic disorder and differentiate it from other conditions. It's not just about feeling anxious or nervous, it's a specific set of symptoms and behaviors that are chronic and persistent. Now let's delve deeper into these symptoms. Scene 3. Symptoms of panic disorder. The manifestations of this condition can be quite diverse, but typically include palpitations, pounding heart, or an increased heart rate. Sweating, trembling, or shaking are also frequently observed. Some individuals encounter sensations of shortness of breath or a feeling of being smothered, while others express fears of choking. Many articulate a sense of unreality or disconnection from oneself. Nausea or abdominal distress is prevalent, as are feelings of dizziness, instability, lightheadedness, or faintness. Some individuals with panic disorder also experience chills or hot flushes, numbness or tingling sensations, and a dread of losing control or going mad. Scene 4. Causes of panic disorder. The reasons behind panic disorder are not fully comprehended, but research indicates that a blend of elements such as heredity, pressure, and certain alterations in how sections of your brain operate may have significant involvement. Paramount to acknowledge that panic disorder is an authentic ailment that can be efficaciously remedied. Furthermore, it's essential to understand that it's not an indication of frailty or a personality defect. Scene 5. Treatment options for panic disorder. The primary treatment strategies for panic disorder encompass psychotherapy and medication. Cognitive behavioral therapy has emerged as the most potent form of psychotherapy for this specific disorder. The use of medications such as antidepressants, benzodiazepines, and occasionally certain anticonvulsants and beta blockers is also a part of the treatment regime, but only under the careful guidance of a healthcare professional. Scene 6. Recap and conclusion. In this wrap-up, panic disorder is an alarming health condition marked by unforeseen and recurrent instances of profound fear coupled with physical symptoms. It's brought on by a blend of elements comprising genetic stress and alterations in brain function. The silver lining is that it can be effectively cured with psychotherapy and medication, is here to equip you with further knowledge into the realm of psychology. If you found this video informative, think about subscribing to our channel for additional content like this. Bear in mind, there's no disgrace in seeking help. If you or someone you're aware of is battling with panic disorder, get in touch with a healthcare provider. Thanks for tuning in. Until our next interaction, keep learning, keep growing.